All right, guys, since the last video did so well, as per more requests, this is other suture tutorial. So the first thing I want to talk about today is how to grab your needle driver. When I first started working with one of the neurosurgeons I work with, he told me to do it this way, and it really gives you more control because you don't put any fingers in the holes. So it's called palming the needle driver. So the way you do it is you palm it like that, and then you can unlock and lock it like that. And what that allows you to do is like use your finger to give you more dexterity. And when you want to turn it, you can actually like flip it instead of turning your whole hand. So it just gives you more control. And then Adson, a lot of people, when they're new, they're holding it every weird way. Like I know my wife was holding it hella funny, but the way you hold it is with two fingers. It gives you the most control. Okay, so now that we know how to palm a needle driver and how to hold the Adson properly, I'm gonna show you two simple sutures that we use in surgery all the time. The first one is gonna be how we close the subcutaneous layer usually. And so this is how you do it. So let's assume this is the incision site. What you wanna do is you wanna grab it, you wanna go from deep to superficial, right somewhere near the skin, but not on the top of the skin, okay? And then you grab your needle again. Then what you want to do is grab it just like this, so you're ready to throw the next bite. And for the next bite, what you want to do is come from superficial and go deep, okay? Just like that. And then you can push it through more, however much you need to be able to grab it. Unfortunately, this Adson is really bad, so it's not my best work, but please cut me some slack. And then how you want to tie it is, I usually like the one-handed tie. So you come in through, you grab the suture, and then you tie it just like that, and boom, you can see the skin coming together. I don't want to push it too much because the suture pad always keeps ripping on me. And then you want to throw another knot just like that. You can tighten it, and then throw it one the other way, tighten it just like that, and throw one the same way as the first one, and tighten like that.
The cool part about the suture is that the knot ends up in the bottom, and this is what we call the buried suture.
Okay, the next suture I want to show you is a simple suture.
The simple suture can have many advantages. Sometimes we use it to close the skin. Sometimes we use it when perhaps there's an infection and we don't want to close the skin too tightly. And then also it can be used in the emergency department when patients come in with lacerations and things like that.
Is you go from one end. You can either come out and take it in two bites, or sometimes what people do is just take it in one bite, just like that. Okay. I like to take it in one bite because it makes the process simple. And how you want to tie it, so we'll do a how to tie with the needle driver, okay? So you want to go twice around the needle driver, grab that thing, and tie it like that. Go once around the needle driver, grab your suture, tighten it just like that. Go one more time, usually about 4 knots is good. And for this type of suture, you want to cut it longer than usual because it's going to help when these come out, because these are going to be non-absorbable. So once the medical assistant or whoever's taking them out, they can cut it off for the patient. Hope that helps, and we'll see you in the next video.